Let's study epistaxis. Epistaxis means that there is bleeding from the nose. Epistaxis may be a symptom or a sign, but it is not a disease. Classification of epistaxis. On the basis of etiology, the epistaxis can be primary or the secondary. It is primary when the cause is unknown, so idiopathic. Secondary when the cause is known. On the basis of site of bleeding, the epistaxis can be anterior epistaxis and the posterior epistaxis. Anterior, if bleeding is anterior to the piriform aperture, and posterior epistaxis if bleeding is posterior to the piriform aperture. Causes of epistaxis. Firstly, the causes of epistaxis can be unknown, which is the idiopathic, and the epistaxis nosebleed can be due to the dry weather or breathing dry air like in room heating, in coughing, in violent sneezing, lifting heavy objects, straining, and blowing nose. Hypertension does not cause epistaxis, but if the patient has hypertension, it ensures continued hemorrhage once it begins. Pyrexia. Pyrexia causes peripheral vasodilation and the dehydration, due to which epistaxis occurs. Local causes of epistaxis can be due to trauma. If the patient has the habit of nose picking, if there is fractures, epistaxis can be due to the infections like acute rhinitis, common cold, rhinosporidiosis, rhinosinusitis, atrophic rhinitis. Epistaxis may be due to the tumors and granulomas, carcinoma of the nose and the paranasal sinuses, juvenile angiofibroma. If there is foreign body like leech, rhinolith, if the patient has deviated nasal septum. There may be the general causes of epistaxis, like if the patient has hematological diseases like leukemia, idiopathic thrombocytopenic purpura, blood dyscrasias, if the patient has the history of drug intake like the anticoagulants, if the patient has cardiovascular disease like the valvular heart disease, mitral stenosis, and the mitral incompetence. In valvular heart disease, there is a stasis of the venous stasis in the head and neck region due to which epistaxis occurs. If the patient has liver disease due to lack of vitamin K, if the patient has hereditary disease like hemorrhagic telangiectasia, if there is any acute febrile conditions like measles, influenza, chickenpox and pneumonia, febrile conditions in pyrexia, there is peripheral vasodilation and the dehydration due to which epistaxis occurs. In case of angiofibroma, rhinosporidiosis, and blood dyscrasias, there is profuse epistaxis. Key sites of bleeding. In epistaxis, the bleeding occurs from which sites? The sites is the Little's area, retrocolumnar vein, Woodruff's plexus, and the sphenopalatine artery. There are 4 sites for the bleeding in the epistaxis: Little's area, retrocolumnar vein, Woodruff's plexus, and the sphenopalatine artery. The Little's area is the anteroinferior part of the septum, which is posterior to the columella. Little's area is has rich vascular anastomotic supply, which is formed by the end arteries called the Kisselbeck's plexus. And the bleeders can easily be identified. The bleeders appear as raised pinhead on the mucosal surface. Here we can see the Little's area, the Kisselbeck's plexus, which is common origin for the anterior epistaxis. It is formed by the anterior ethmoid artery, superior labial artery, greater palatine artery, and the sphenopalatine artery. This is the Woodruff's plexus, which is the common origin for the posterior epistaxis. So, Little's area, which in this there is Kisselbeck's plexus. Bleeders can easily be identified as it appears as raised pinhead, retrocolumnar vein. As this is the most common site for the nose picking, so this is the most common site for epistaxis in the children, and retrocolumnar vein is found along the mucocutaneous junction in the anterior part of the septum. Woodruff's plexus, which is the venous plexus, It is inferior to the posterior end of the inferior turbinate. It is a common site for posterior bleeding in the older patients. Woodruff's plexus is responsible for the posterior bleeding in the older patients. Bleeding usually occurs from the posterior part of the nasal cavity if there is atherosclerotic changes within the blood vessels. When the patients uh, becomes old, elderly patients have mostly the elderly patients have the atherosclerotic changes within the blood vessels, due to which there is bleeding from the Woodruff's plexus. Sphenopalatine artery, which is the artery of the epistaxis. So there is total 4 sites of bleeding: Little's area, retrocolumnar vein, Woodruff's plexus, and the sphenopalatine artery. Here we can see this is the sphenopalatine artery. This is the Here we can see the sphenopalatine artery. This is the sphenopalatine artery. This is called the artery of epistaxis. Now the difference between the anterior epistaxis and the posterior epistaxis. The epistaxis, which is above the pterygo pyriform aperture, bleeding anterior to the bleeding which is anterior to the pyriform aperture is the anterior bleeding. Pyriform aperture is the demarcating point, which is anterior to the pyriform aperture. There is anterior epistaxis, and posterior to the pyriform aperture is the posterior epistaxis. Pyriform aperture. So anterior epistaxis, which is anterior to the pyriform aperture, posterior epistaxis, which is posterior to the pyriform aperture. Anterior epistaxis is more common, but posterior epistaxis is less common. Anterior epistaxis most commonly occurs in the children and the young adults. Posterior epistaxis mostly occurs in the middle-aged and the elderly. Site of the anterior bleeding is the Little's area and the retrocolumnar vein. We have studied the 4 sites: Little area, retrocolumnar vein, Woodruff's plexus, and the sphenopalatine artery. In 4, the Little's area and the retrocolumnar vein. This Little's area and the retrocolumnar vein is the site for the anterior epistaxis. Woodruff's plexus and the sphenopalatine artery is the site for the posterior epistaxis. Woodruff's plexus and the sphenopalatine artery is the site for the posterior epistaxis. The causes of the anterior epistaxis is mostly the trauma, but posterior epistaxis is spontaneous. The bleeding in the anterior epistaxis is mild, which trickles through the nose, and it is easy to localize. But the bleeding from the posterior epistaxis is profuse. Blood is in the posterior pharyngeal wall, and it is very difficult to localize. The treatment of the anterior epistaxis is by cautery, by chemical cautery or bipolar electric cautery, and by anterior nasal packing. But in the posterior epistaxis, the treatment is by posterior nasal packing and the endoscopic sphenopalatine artery ligation. As the sphenopalatine artery is involved for the posterior epistaxis, we can ligate this artery and do the posterior nasal packing in the posterior epistaxis. There is total 4 sites, 2 sites in the anterior epistaxis, Little's area and the retrocolumnar vein, Woodruff's plexus and the sphenopalatine artery in the posterior epistaxis, anterior to the pyriform aperture, anterior epistaxis, posterior to the pyriform aperture, posterior epistaxis. This is common in children, this is common in middle-aged, elderly. Cautery, anterior nasal packing, posterior nasal packing, SPAL, endoscopic sphenopalatine artery ligation. In the management of epistaxis, there is 4 steps, which is the REST. R means resuscitation. Firstly, resuscitation, in which after that establish the site of the bleeding, then stop the bleeding, then treatment of the underlying cause after ensuring general measures and an investigation. Now we will study individually. First, resuscitation, establish the site of the bleeding, then stop the bleeding, then treatment of the underlying cause after ensuring general measures and investigation. In resuscitation, we do the initial measures. In initial measures, we record the pulse, blood pressure, and we see for the signs of the shock like the pallor and the sweating. And if there is necessary, then we open the IV line and blood is sent for the cross matching, and blood expanders or hemacil should be started. Then for the assessment of blood loss, We ask the patient the amount of the blood loss, as the patient always try to exaggerate, so we ask in coughs, the number of coughs, the bleeding in the number of coughs. So firstly we are done with resuscitation, in which there is and the initial measures and the assessment of blood loss. After that E, establish the site of the bleeding. For the site of the bleeding, epistaxis is almost always unilateral, except if there is severe trauma to the nose or bleeding diathesis. But we can ask the patient which side he or she bled first, which can be the site of the bleeding. We can also establish the site of the bleeding by the anterrhinoscopy and the endoscopic evaluation. Our resuscitation done, then establish the site of the bleeding is also done. Then after we stop the bleeding. RES, stop the bleeding. We stop the bleeding by the Trotter's method. Here we can see the Trotter's method. Sit. After that, pinch the nose, pinch nostrils and breathe through the mouth. Sit and lean forward slightly. So this is the Trotter's method. Then we do the cautery by the chemical agents or the bipolar electric cautery. Chemical agents for the cauterization is the silver nitrate and the chromic acid. Then we do the antranasal packing, posterior nasal packing, septoplasty with bilateral flap elevation, then arterial ligations. Endoscopic sphenopalatine artery ligation. We are done with the resuscitation, establishing the site of the bleeding, then stopping the bleeding, then treatment of the underlying cause after ensuring general measures and investigations. In anterior nasal packing, we use the ribbon gauze smeared with BIPP, bismuth, iodoform, paraffin paste. Bismuth is used for astringent and iodoform is the antiseptic, and liquid paraffin, this paraffin is used as the lubrication. But there are commercially available nasal packs also, like the Merosil and the Rapid Rhino. This is the Merosil and this is the Rapid Rhino. There can be the complications of nasal packing, which is the vasovagal syncope, rhinosinusitis, synecdoche, septal perforation. If the patient is elderly, then hypoxia may occur, toxic shock syndrome, cardiac arrhythmias, which is very rare. In posterior nasal packing, there may be necrosis of the columella leading to columellar retraction. There may be necrosis of the ala of the nose due to pressure necrosis by the knot or umbilical cord clamp. So in epistaxis, this is the nosebleed. We see the classification based on etiology, primary or secondary, based on site of bleeding, anterior epistaxis, posterior epistaxis. Then we see the cause of epistaxis, in which there is the local causes, trauma, infections or tumors, foreign body, DNS, deviated nasal septum, due to the general causes like hematological diseases like the drugs, cardiovascular diseases, liver diseases, hereditary, acute febrile conditions. Profuse epistaxis is seen in angiofibroma, rhinosporosis, blood dyscrasias. We see the key sites of bleeding, 4 sites, Little's area, retrocolumnar vein, uterus plexus, sphenopalatine artery. Then we see this Kisselbeck's plexus formed by the anterior ethmoidal artery, sphenopalatine artery, superior labial artery, greater palatine artery. Anterior ethmoid, sphenopalatine, superior labial and the greater palatine. These 3 branches are the branches of the external carotid artery, and this anterior ethmoid, posterior ethmoid are the branches of the internal carotid artery. Then we see the difference between the anterior epistaxis and the posterior epistaxis, which is the common. Anterior to the piriform aperture is the anterior epistaxis, posterior to the piriform aperture is the posterior epistaxis. Then we see the management of the epistaxis in the 4 steps, which is REST, resuscitation, then establish the site of bleeding, then stop the site of bleeding, then stop the bleeding, then treat the underlying cause. Then we see this Trotter's method, cautery by chemical agents is silver nitrate and chromic acid. Silver nitrate and chromic acid. And then antranasal packing, BIPP, bismuth is astringent, iodine is antiseptic, paraffin is helps in the lubrication. Commercially available, Merosil, Rapid Rhino. Then we see these complications, as well as the syncope, rhinosinusitis, synecdoche, septal perforation, hypoxia, toxic shock syndrome, cardiac arrhythmia. In posterior nasal packing, there may be necrosis of the columella and necrosis of the ala of the nose. This is all about the epistaxis. You can find these notes on the Telegram, and the links are given in the description. Thank you.